More than 40 years ago, when the first cases were identified actually in the U.S., a CDC report that came forward stating that that period between October of 1980 and May of 1981, 5 young gay men were treated for a lung infection common in what would become known as AIDS. 2 of the patients died. Well, today, more than 1.2 million people in the U.S. have HIV now, and that infection causes AIDS. However, a new treatment that worked on one woman she's actually the 3rd person ever to be cured of HIV. We want to talk more about this with infectious disease specialist at South Shore Health, Dr. Todd Ellerin. Dr. Ellerin, appreciate you being here. We talked about this yesterday, how this woman was cured and how this treatment worked for her. Let's just lay out the details of this and what you think about the news that we got yesterday.
Good morning, Kara. This is really exciting news. Okay, this woman, we think she's about middle-aged, from New York. She basically had HIV several years ago, and then a few years later developed leukemia. So HIV and leukemia, not a common combination, but patients with HIV can be at increased risk of certain forms of leukemia. So then what happens is she's taking her antiviral medications, and she's doing well, but then she needed a transplant, okay, to help her leukemia. And what she had was actually 2 transplants, one from a family member, a primary family member, and then she had an umbilical cord stem cell transplant. Remember, the umbilical cord is a little segment that connects the baby to the placenta, allows nutrients. They are rich with these stem cells, these magical stem cells that can form, many different forms. So the key here is those stem cells had an unusual mutation that prevents HIV from entering the cell. She was transplanted with that, and then lo and behold, months later, she stopped her HIV medications, and we cannot find HIV anywhere in her body right now. So essentially, she's being considered cured, or at least in a very long remission. But she's the first woman that this has happened to. It's happened to 2 other men years ago. Both of them were cured of HIV, so I do believe she is cured. The one thing I want to say, Kira, is that while this is so important as a beacon that's going to shed light on future gene therapy research that could really help us ultimately with cure, this is not generalizable to the majority of patients with HIV, because these either bone marrow or stem cell transplants do carry some risk. And what we know now is that daily HIV medication, they're so safe and effective in controlling HIV. But I think this is a real promising step in the right direction.
So why do you think it went well for her? Because we've covered cord blood stories, and they are very, in some ways, experimental and sometimes risky. So why do you think this worked for her? And even though it's been a very small amount of people, and you look at how many people have HIV, is it a step in the right direction? What more needs to happen to make it more available, or even know if it could work for other women?
Right, so these are great questions. A few things to know is that cord blood, umbilical cord stem cells, that type of transplant is gentler than the typical bone marrow transplant we think of. The actual transplant, you don't get as much what's called graft versus host, where the actual transplant can actually, kind of turn against the body. So with umbilical cord transplant, you see less of that. That's one thing. But one of the issues is that, this umbilical cord stem cells are really sort of precious gems. They're not as abundant as bone marrow transplants. That's one of the reasons that we don't use them for every patient. In this woman's case, she actually first got a sort of mini transplant from a family member. So that allowed her to have some immunity, while the stem cell transplant from the cord blood was able to take time to engraft. You see, cord stem cell transplants take longer before they sort of become durable in the body. So during that period of time while you're waiting, the host can really be vulnerable to infections. So I think the Cornell team really was well, I'm going to say brilliant in thinking about the way to treat this woman.
Okay, so then final question, because when my kids were born, there are companies that tell you to save the umbilical cords for future discoveries. We were sort of on the fence about it, but we went ahead and did it. Is this something, do you think, that all parents should start doing now? Bigger picture here?
From a big picture, if it didn't cost anything and, you know, you could do it easily, I mean, sure, that would make sense in the rare chance that you're going to develop one of these rare, you know, cancers or other sort of blood type disorders. But I can't say that everyone should do this right now because it is costly and, you know, it would be infrequently used. But all things being equal, sure, it would be great to have this in your back pocket if you ever needed it.
And it is costly, by the way. It's a big reason why I was asking. You kind of wonder, you know, the reward, is it worth it? But good discussion, Todd. It really is pretty amazing what we did learn about this and just looking to the future of treatment for HIV. Appreciate your insight. Thanks, Doc.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.